Go ahead.
Thank you, Mike, Nancy, Sally. Steve, you deserve extra step counts on your Fitbit.
I do.
For the number of interviews you have done back to back. And as we just have been hearing, Fitbit is a dominant player in the world of wearables. The company's co-founder and CEO, James Park, is here leading the charge. He's a serial entrepreneur. Fitbit is Park's third venture, and he doesn't show any signs of slowing down.
How are you, James? Thank you so much for joining us. Thank you. Do you want to, walk around and
no,
you have
I'm
yours?
good.
How,
I'm good.
How many?
Not great today.
Yeah, you're not great.
Yeah.
We got to go out somewhere. So, who are? Well, let's just figure if this is friendly crowd or non-friendly. Who are the Fitbit wearers in here? Put your hands up. See, this crowd. No, Kami, you're really bad. You need to get to. You're a jawbone wearer, no doubt, right? So, have a seat, James. Let's have a talk where we could walk around. I was going to walk around on stage, but there's not enough room. Thank you very much for joining us.
Thanks for having me.
We've had a lot of talk today. This other side of me is a Numa made by Numitra stress watch, and it buzzes every time I get into the red zone, which has been frequently all day today. So I'm very happy that my Fitbit does not buzz and stress me out. So
actually, I just walked up here, so my heart rate's about 110 beats per minute.
Oh, that's great. So, I'm really interested, we're obviously having a big health forum, but I'm interested in the fact that wearables kind of popped up, that you're in a town. I know you don't come to Washington very often, so I'm really interested in what you're doing here, how many members of Congress wear Fitbits and all that. But, one of the really interesting challenges of being, somebody affiliated with The Atlantic, which looks at consequential ideas and themes and is based here in Washington, D.C., is that most great ideas don't come from Washington, D.C. They come from the West Coast or somewhere else. So we like to bring people like you to Washington to show Congress and this town what's possible. But give us a quick version of the Fitbit story.
Yeah, so really the inspiration for Fitbit was the Nintendo Wii. It's late 2006, and I was one of the first people to buy a Wii. I waited at Best Buy at 6 a.m. So I was pretty excited, and I was just really fascinated by the way Nintendo had combined sensors and really fun and amazing software and made gaming and fitness really entertaining, magical for people. It made gaming something that was very positive and active rather than sedentary and what you associate with gaming.
And it put you in the middle of it, right?
Yeah, it's totally immersive. And my co-founder Eric and I thought, how do we capture a lot of this magic and put it into a more portable form? Because obviously the Wii experience had you tethered to the living room. So we came up with this idea for a small portable device that was wireless and could track your daily activity patterns, your sleep quality, et cetera. And we announced the product at a conference in San Francisco called TechCrunch 50. And we actually told people shipping at Christmas. And unfortunately, I don't know if people have bought or donated to hardware Kickstarter projects, but we did ship at Christmas, but it was Christmas the following year, so a little late. And at the beginning, we actually didn't know how popular the concept would be. And my co-founder and I had a bet at the conference as to how many people would be dumb enough to give us their credit card information for this pre-release product. And he said, I think about 5 people. And I said, Eric, you're too pessimistic. I think there'll be about 50 people. So by the end of that first day, it was about 2,000 pre-orders. So
wow.
We thought we were onto something. And
how big are you now?
Obviously, we started off with 2 people. We're a little over maybe about 520 people right now. 500 people,
but how many people? How many Fitbit wearers are there in the world?
We don't disclose those numbers.
Oh, really?
But,
just to me, just off the record.
Off the record, sure. Yeah.
How many countries, how many stores?
50,000 stores in over 50 countries right now. So we feel it's a pretty global phenomenon, this whole notion of using technology to understand our lifestyles better.
I'm sure, so I know the president wears a Fitbit. And
yes.
Have you been up on the Hill today? I mean, you're friends with Heather Podesta, so you must have been.
Yes, a couple days.
And how many Fitbits did you encounter?
Depends on the staff. I mean, I think we had
the staff.
Yeah, we
the
had
staff are Fitbit wearers, but not the members.
Staffers, definitely. We had one meeting where I think 3 out of 4 staffers that we met with had a
They were trying to impress you, I bet.
Maybe.
So when you look at that in that scale, I'm sort of interested in the vignettes that you probably have heard about, and you weren't here earlier, but I mean, it was one of these things where I become fairly obsessive about it, because for me I was having a problem. I'm a runner. I used to be a really obsessive runner. I used to run 3 times a day, and working for the Atlantic, I can't hardly run anymore. But I would go run 9 miles, and then I wouldn't run for a month. But this has created this daily obsession. To the other day on a plane, I had to do 3,000 steps. I really did do this. I got a witness to sign that she saw me do the 3,000 steps on the plane, so I wouldn't miss the day. Like, I'm obsessed with getting it clocked every day. But what are the best vignettes you've heard of how Fitbit has impacted people?
Obviously it's really addictive for a lot of people, and it gets ingrained in their daily activity, and there's a strong feedback loop that's created. So one of my favorite stories is early on, we launched this feature called badges, where you win badges for different accomplishments. Right. And we didn't tell people like what all the badges were. So it became a game.
David Sedaris got a badge for 60,000 steps a day. Is that true? Have you met David Sedaris?
I have not, but we don't, obviously from a privacy perspective, can't comment on individual users.
He says he got a badge for 60.
I trust him.
Yeah.
Seems trustworthy. So.
I don't know if you read this David Sedaris article about his Fitbit experience. Read it if you haven't. It's about extreme obsessiveness about this. And I thought it was a joke until people began to, there was a dump truck sort of named after him because he was doing his picking up of trash and litter as he was doing his, first started with 10,000 steps a day, and he said that's just nothing everybody does. It's not true. 10,000 steps a day is, 10,000. Please tell me it's significant.
It's significant for most Americans. I would say, for...
Screw you.
Most Americans are sedentary. So, they're waking up, driving to work, sitting at their desk, driving home.
What is yours set for?
I have a daily goal of 15,000.
Okay.
So probably past 7 days, I'm at 102K.
I'm going up to 15 now.
Okay.
Yeah.
Everyone has to, aspirational.
Factor.
Yeah.
How many teammates do you have?
I have about 40 friends.
Want to connect? Yeah.
Sure. Yeah.
Okay, you heard it. It's on video.
As long as you're below me, I'm fine adding friends. Okay. I try to moderate the number of people who I know are more active.
But when you go to places, so I was recently in the Middle East, and you go to places there were a lot of diabetes, a lot of problems of inactivity, a lot of problems with this. But I've begun to see people in Doha, in Dubai, and places with Fitbits, and they're beginning to understand. I have to say that, again, not scientifically, but just anecdotally, people sense this and see this as a way for them to escape what is a broader social problem. Are you anecdotal, hearing many of those anecdotes and getting feedback on that front?
Yeah, we do. Early on, it really started off as a North American phenomenon and then gradually spread to other English-speaking countries. But a lot of our growth now is from outside English-speaking countries because issues like cardiovascular disease, it's a leading contributor of death worldwide. And even places like Japan, incidences of type 2 diabetes are rapidly increasing. So there's a growing consumer awareness of health issues and how devices like the Fitbit and others can really help address that. And in particular for us, from a commercial point of view, we've had to localize our marketing in certain regions like the Middle East. For example, it's obviously way too hot to be walking extensively outdoors.
But you can do a lot of mileage in a mall.
In a mall. So malls are big. We try to organize walking events within malls. So that's been really interesting to see.
How about walking events in airplanes?
That's a new frontier.
Yeah, I think it would be good. You guys have a...
Thanks for the suggestion.
Do you have a secret R&D lab like a Skunk Works where you're inventing the next big Fitbit thing?
We do. So we have a separate R&D group.
I didn't know that, actually. Really? You do have a secret R&D group?
I don't...
Yeah, okay. Skunk Works, okay.
Yeah. So it's a totally separate group apart from our product engineering. And so they're tasked with developing sensors and algorithms for products about 3 years out.
Can you give us an idea of what some of that is?
I can give examples of current output from that group. So,
okay, great.
Yeah, so some of our latest products include on-wrist continuous heart rate monitoring. So that was a technology that was in development for about 3 years. So the big issue before this was, the only way to get heart rate for consumers in non-medical setting was to wear a chest strap, but it's pretty uncomfortable, particularly for women, and it's not something you could wear all day. So our technology allows us to track heart rate technology 24/7 for 5 to 7 days in a row.
Wow.
And that's enabled us to give consumers a lot of insight about their daily activity, what their resting heart rate is, what the, potentially in the future what their stress levels are, how intensely they're exercising. And we see things like, if people stop smoking, the resting heart rate drops pretty dramatically.
Wow.
Or if they're traveling, their heart rate increases. And we also publish fun stories where in the last Super Bowl, we tracked people's heart rate in Seattle and in Boston.
So you have all this data, right, in some macro form?
In a macro form,
You have like
yeah.
a war room with looking at
It's
all
not
the
as
stuff on it.
fancy as that. It's just everyone sitting at desks in an open space.
But the interesting thing is you do have the data. You can keep the data. You can monitor the data. You'll probably be sort of like this Wizard of Oz type guy. You can see whether the country's becoming more healthy or less healthy, right?
We do.
At some level.
And we do publish that on an aggregate basis occasionally.
You publish that?
We do. So the heart rate data, Seattle versus Boston, we did that. And you could see whenever Seahawks fans got excited and the halftime show didn't really register any type of excitement at all, regardless of left shark versus right shark. So yeah, we do get insights like that.
So what are when I sort of think about the fact that I actually love the wearables, and so perhaps I'm not editorially proper in this, but when you imagine a future of the things like this, it seems like these could be good tracking devices for children or pets. Mm-hmm. These could be measures for a whole variety of health things, but they could also potentially interact with buildings, with cars, with other stuff. So tell us, you've been in so many different dimensions of this, both in your previous positions and what you're now. You understand both finance, but the architecture of things that are developing. Mm-hmm. Are we going to have a Fitbit house? Are we going to have a Fitbit car? Are we going to have a Fitbit clothes?
I think building a Fitbit car would be awesome, but I don't think our investors would support that. Quite outside our purview, but where I do think wearables are going to go is, as a company, we're focused on health and fitness today, mm-hmm. and that's really helped their growth because people understand what our products do, their benefits. I think that's been one of the general complaints against general purpose smartwatches because people don't know exactly why they want to buy or wear a smartwatch. So our clarity on the purpose and of the devices has really helped us, but I do see our devices integrating more with things outside of health and fitness. In the home, whether it's authenticating yourself to a security system or for seniors, things like making sure that people are getting a certain amount of activity or controlling thermostats or other devices around the home. I think that's great. Areas around payment, payments are pretty interesting. If you look at the Magic Band from Disney, I think that's an indication of where things can go.
Tell us about the Magic. I haven't been down to Disney lately.
Yeah, so it's basically a band that you wear at the resort, and you pay for everything with it. You go to rides, you unlock your hotel room, etc. So I think that's a great indicator of where things could go around wearables.
Now, Edward Snowden made the comment when the NSA that he could actually, zero in and dial into someone. Do you have the capacity to sort of see how the president's doing in his steps?
I'm sure technically that's possible, but we wouldn't do that, and our privacy policy is pretty clear that we're not sharing people's personal information without their permission.
That's interesting. So, what are you trying to do in D.C.? What's the James Park agenda in Washington?
Obviously,
schmooze.
I'm not a big schmoozer.
Yeah.
So, I'd rather.
I could turn you into one. You've got the makings.
Yeah, I'm very introverted and I hate schmoozing. I'm more about building products. But obviously, there's a realization that, notions of data privacy, data security are pretty important. So, ideally, we'd like to engage with regulators and government officials.
Have you been part of this process and discussion where the president came out to Silicon Valley to meet a number of people in that arena? Have you been engaged with?
We haven't to date, but I do see ourselves becoming more involved in government affairs. But obviously, our position is that we'd like a more balanced approach to regulation, and we're also taking a lot of steps to regulate ourselves as well. So we feel our privacy policy is very consumer friendly. It really helps that, we are not an advertising or marketing company. We sell products directly to consumers, so we understand who pays for them. and our product development and marketing are geared towards.
I want to go to the audience for a minute, but I want to ask one last question, which is a little complicated. But I've been intrigued with these revelations on cholesterol. I don't know if have you followed this? You can eat eggs now, and without guilt. You can eat eggs. I mean, they're saying
I still feel guilty about it.
I still
just
feel
had deviled
guilty
eggs
too,
for
but
lunch,
I've had a whole life of eating eggs and feeling guilty about it. But it has made one. This is 2015. We're in a modern day. This is not the medieval age. This is something where we're supposed to apply science, look at results, do this, and we're being told that in 2015, our fears about cholesterol were sort of misplaced. And I'm interested in someone in your business that wasn't in this war. Are you discovering other kind of elements of fake science out there? What has Fitbit given you insight into about what the perfect healthy man or perfect healthy woman looks like from a different angle than what we've learned from the medical journals and the cholesterol fear advocates and people like that? Is there
I think
anything along those lines? Do you have a different pattern for people out on the West Coast than we regulatory types in the East Coast?
Pattern in terms of?
Well, we like to regulate it. I mean, I think West Coast innovators and entrepreneurs change the world by thinking they can go and do something. And I think the legislative crowd here thinks they're regulating all of that. But it gets right at that cholesterol debate that we've had sort of a broader set of guidelines from government that said that was wrong, seems to have run against the science. So I'm interested in that, nexus.
Yeah, I think where I see a big disconnect is, we operate solely in the consumer space today, and there hasn't actually been a lot of collaboration with clinical research. And I think that's a big gap. I think clinical researchers have been slow, but getting to the point where they see wearable devices as a huge boon to the type of work they're doing. And I think all of us in the industry should do a better job of sharing data with researchers and uncovering insights. So I don't know if I have a mind-blowing revelation there, but as a company, we definitely like to work more closely with researchers over time.
That's interesting. Let me open up to the floor. This is a great opportunity. Yes, right here. And we're going to give you the microphone.
Thank you. Nancy Carter Foster, president of Carter Foster International. We work on mobile and global
Use
health
your
issues.
loudest, coolest voice.
Okay.
Yeah.
Question about Fitbit and security for wearables overall, especially now that Fitbit data is part of a suit that someone is using in terms of what's normal, what should be compensated for damages, et cetera, by employers, et cetera. And then, of course, the security is with respect to hackers, especially if you're going to be moving into things where you're going to be using Fitbit wearables for access to buildings or pay.
Yeah, so for us, security has always been a pretty important issue. We realized early on as a company we were going to be, by the very nature of our business, being able to collect a lot of personal data about individuals. So our devices are end-to-end encrypted, which I think is different than some of our competitors who've been hacked. And I'd say our data and privacy policies are pretty forward-thinking for the industry. We've been very clear in our privacy policy, and we've written it in such a way that normal people can read it. It's not a lot of legalese. And we've been very clear that we will not share your personal information unless you explicitly allow us to do so. And again, we're not a marketing or advertising company, so we've never sold data to third parties, and we don't have any plans to. But I think for the whole industry, it has to evolve. I think there's going to be greater and greater security threats, not only to wearables, but things like your smartphone. And it just has to be a top priority for all engineering departments across all these companies.
Right over here in the back.
Sure. Yeah. Dylan Nelson with the National Business Group on Health. There are, I'm sure you know, some employers and health plans that are starting to subsidize wearables for their employees, to get, encourage them to be more active. But I haven't seen a lot of information about, connecting to outcomes, and I realize you can't know necessarily whether people who are wearing Fitbits are, reducing their likelihood to get diabetes or something like that. But can you see?
But they can look at weight. I mean, the reported stuff.
Yeah.
Right?
So can you see outcomes? What kind of things are you seeing amongst your?
Yeah. So I think getting to clear monetary ROI is going to be very difficult, and it's going to take a much longer time frame. I mean, this whole industry is still pretty young and early. We're probably one of the oldest at about 8 years, but our products have only been in the market for 6 and really on a mass scale for the past few. But there's a lot of intermediate measures and data points that we do see and we do explain to employers. For instance, users after about 12 weeks increase their activity by about 40%. So that's a very positive thing. We have seen weight loss in controlled studies. So these are all data points that we do explain to employers. And obviously employers are looking for any way to lower their direct healthcare costs. And other than these data points, they do see a lot of just employee excitement and engagement in having Fitbits as part of their wellness program. So there's this intangible benefit of this.
Is yours available on the open market, or is this like a special James Park only version?
This color is a special edition.
Yeah, it's really cool. I want to
put together by
can
our
I take a
engineers.
picture of it and just like, I just want to tweet your watch, you know. But you are doing some things with Tory Burch, right? You're doing
Yes.
you're getting into fashion. Is
We
that
are.
weird for you?
Maybe weird for me, but I think there's a realization that for wearables to become really mainstream, you have to infuse and combine fashion and technology, and we're not necessarily experts in fashion. So one of the great collaborations.
So what's her coolest idea?
She's created an exclusive line of pendants and bracelets, and it's been really well received. I think the first day that it was available on Tory Burch, it sold out in 3 hours, the whole collection. So I think there's a lot of people who are just interested in, just how to incorporate these devices more seamlessly into their daily life.
Interesting. Yes, in the very back.
Hi, Mr. Park. Ken Siletz with the Information Technology Industry Council. We represent everybody from Apple to VeriSign and probably half your
He's a
neighbors
powerful
in Silicon
guy.
Valley.
Yeah.
A couple of things. One is extreme compliment for the tremendous customer service. I bought a Fitbit for all of my family, significant others, and everything else. My son lost his on the way to the Dulles terminal and called up just to see if he can get the data transferred, and you sent him a brand new one. So I want to really compliment the company on that. Second thing is we do global work at ITI, and one of the continents I'm looking at right now and involved in is Africa. And show off my Fitbit to the Kenyans and the South Africans and Zimbabwe, and there's a huge demand and interest there. So a question is, first question, are you involved in Africa? Are you looking at it? And then secondly, my daughter just texted me, said, can she get a job with you?
Okay, keep the mic away from him. Drop the last question. No nepotism. But how in Africa?
We are sold in South Africa and the Middle East. For us, we're still a pretty small company. I mean, I'm personally amazed at our growth for the past few years, and it's been a learning experience for me to manage just myself and then manage 500 people. But I'm sure Africa is one of those countries that we do want to get to, and it's on our list, but it'll take time for us to get there. On the customer support thing, it's not published that we do that, but our customer support policies from the very beginning have been heavily influenced by companies like LL Bean, who want to be pretty friendly. So, yeah.
This gentleman in the back.
And then we have a Twitter question as well.
And we have a what? Oh, we have a Twitter question. Hi, Twitter people. So glad you're out there. Yes, go ahead.
Hi, my name is Dr. Johan Lee. I am actually a clinical researcher. And so I'm interested, from your perspective, what are some of the barriers that Fitbit has with working with clinical research?
Interesting.
Yeah, I think a lot of it's been one issue of resources from our point of view, issues of grant money and the amount of funding, and then also the technical and data transfer infrastructure issues. So, historically, we really haven't been able to provide that many services or support for researchers, and that's one area that I'd like to change over the next couple of years.
And the Twitter question.
Yes, this comes from Beth Cantor, @Cantor. To Fitbit founder, have you seen it motivate wellness in workplace?
Yes, definitely. I mean, I cited some of the stats before, and some of the other interesting pieces of data that we've seen is obviously there's a huge social element to what we do. People can compete with their friends and family across a variety of metrics, and what we've seen is that for every friend that you add, you increase your activity by about 1,000 steps per day, up to about 7 friends. So you can just stop at 7 and that's enough.
Wow, wow.
Yeah,
Interesting.
that's all you need.
Hey, if we just close up, let me ask you a question sort of off the topic of Fitbit. You're described as a serial entrepreneur. I've done some traveling with Steve Case through the Midwest United States and something called Rise of the Rest tours to sort of look at, the combination of, investors and entrepreneurs with some great idea and kind of beginning to look at this. But every great entrepreneur I have met didn't just do one thing. So I guess my question in a provocative way is, how long will you be with Fitbit and what's your next thing? And what advice and counsel do you have for other entrepreneurs out there?
I should actually update my bio because I don't like the serial entrepreneur bit anymore.
Okay. So, Heather?
So,
So you are going to stick with Fitbit for
I think
ages?
it's a pretty long-term gig.
Okay.
So, I'm pretty.
Pays well.
Maybe at some point.
Yeah.
So, I think at this point my identity is pretty wrapped up with the company. It's been 8 years. It's a very fun job. The big thing for me is being able to see ideas, being able to quickly transfer from my brain into reality. And as much as I enjoyed the early years, it's much easier to see that process happen now with a 500-person company than when it was just my co-founder and I in a really crappy.
Was there a point where you thought you wouldn't make it?
Many times. Yeah. I think every company has that, especially for a hardware company. We probably experience more than what's usual for a software company. I think hardware company is probably one of the hardest things that one can do.
Well, ladies and gentlemen, James Park, Fitbit CEO and co-founder, thank you so much for joining us. That was fun. Thank you.